To today's session, which is on the disabled students' allowance and government reforms, and we are taking oral evidence from 3 panels. Our first panel consists of Tara Chattaway, Head of Education at the Thomas Pocklington Trust, Lesley Morrice, Chair of the National Network of Assessment Centres, and Sarah Todd, Chair of the National Association of Disability Practitioners. Thank you very much for coming to give evidence to the committee today. Can I ask, from your perspective, how has the Student Loans Company changed the way it is delivering disabled students' allowance, and perhaps more importantly, why? Who would like to start on that? Sarah? Yeah.
I can start.
Thank you.
So, under the previous system, there were difficulties in terms of the student understanding how to navigate the journey effectively. The points of communication relied heavily on the student understanding what to do next and being able to carry out those actions. So one of the key changes that I think the whole sector wanted to explore was how we could better support the student through that journey and better support the student through that journey more quickly so that they could take up the support sooner. In order to do that, what has been looked at is a procurement model whereby there are now 2 suppliers responsible end-to-end effectively for the student journey from needs assessment, recommendation of support and provision of certain elements of DSA support. With that comes benefits, but with that also comes a number of challenges that we'll explore today.
Okay, thank you. Anything to add to that, Tara or Lesley? Yeah.
Yeah, I mean, prior to the new system coming in place, there were assessment centres around the country. As was said previously, the National Network of Assessment Centres has actually been going as our previous organisation for 35 years now. We've been assessing DSA students for 35 years. There was a skill review which recommended changes, one of which was that we had a quality assurance group who audited centres, and we had to complete monthly KPIs. That process was still seen to be too slow for the student and not joined up, which is why they've gone down this route. Right. So instead of having the number of assessment centres that they had previously and who were audited under DSA QAG, they have gone to this new supplier where there's just the 2 main suppliers.
Okay, and we'll come back to the impact of that change. Is there anything from your perspective, Tara, that you think is important to add for the people you represent?
Yeah, so we support blind and partially sighted students, which is a low incidence number that go through this journey. So part of the changes, there were lots of reports as well around disabled students' experiences. So we did a report along with RNIB, Policy Connect had Arriving at Thriving, we had Lord Holmes of Richmond's report, and also the University of Birmingham did a longitudinal study that followed students that found that the DSA journey was really difficult. So just to explain, what would happen is a student would get a DSA 1 letter that would then tell them that they could contact an assessment centre. That would confuse students because they're like, well, I've already been assessed, so what does this? It wasn't properly explained that it was an assessment of need. They then would need to contact an assessment centre randomly because all assessment centres were meant to provide the same quality support. But what we found from students is that quite often they would go through that assessment process, and some of them had a brilliant experience because there were some really good assessors and assessment centres, but some of them would have a really poor experience. There would be recommended stuff that really wasn't relevant. Then they would have an assessment form would go to them, then that would go back to the Student Loans Company. There could be some to-ing and fro-ing. They'd then get a DSA 2 letter to say you've been awarded this support, and then they would have to go and contact their non-medical help support, their trainers, and the assistive technology providers. So again, that was a whole other level of admin.
That sounds like a long process as well. What sort of timeline are we talking about for that?
So for students with a vision impairment, it could take a lot longer because some of the needs is a lot more complex, and also they're very reliant on a number of different assistive technology. Some of them didn't ever take up their assistive technology training or were waiting a long time for it. And non-medical help, which isn't in the scope of this, what would happen is they would often contact their non-medical help provider who would say, oh, we can only provide some of it. Then they'd have to go back to the assessor. So we would support some students that would be way into their first sort of semester of university still not receiving the support that they needed in place because of this process. So the idea is that this then means that there's one sort of point of contact for them now to be able to understand that journey. When we'd raised some issues with Student Loans Company and DFE as well, what they told us is that they couldn't track that whole journey of end-to-end to actually receiving the equipment for the students. They didn't know necessarily how long that process was taking. And quite often we would raise issues and we would be told, well, nobody's really complained. And that was the other thing, is actually there was no process to complain. So we'd speak to a student and they wouldn't know who to contact. So of course their experiences weren't being fed up because there wasn't that mechanism in place.
It sounds from what you're saying that there's quite a strong case for change here,
Yes.
fundamentally, and that what has been the feedback so far in terms of the new process, or is it too early to say, really?
It's too early to say. So overall, the communication, the clarity of the process, and in terms of what has and hasn't already started, has been extremely poor.
Right.
The contracts were supposed to start over a year ago. They started in February this year. But my understanding, only from yesterday, from a communication that was only sent to a small number of people and not circulated widely, is that actually only part of that process is under the control of the new suppliers at the moment, and that there are still elements of that process that are to be introduced in the summer and further elements to be introduced at the beginning of the academic year. So students are now actually having to provide documentation and evidence at two separate points in their journey in order to have an appropriate needs assessment, which means more admin for the students, and also the sharing of those documents. The data sharing isn't yet in place appropriately, so we effectively have two contractors responsible for end-to-end, but the student is taking on the burden of the administrative challenges. Those contracts aren't ready to deliver end-to-end at this point.
Which is partly what the reform's designed to remove in the first place, so
yeah.
that is frustrating. And Lesley, in terms of the impact on assessment centres, presumably a number of assessment centres have been removed from the process.
It has been a massive impact. The goalposts have changed again in terms of, I think the original tender was just going to be for the equipment supply, and in 2019 they told us that it was going to be for assessment centres as well. The tender process for the equipment suppliers went right through as far as people putting in their tender bids, and then it was abandoned. They then subsequently announced that instead of having two separate tenders, they were joining the whole thing together, so assessment equipment and then the AT training. When the Quality Assurance Group closed in December 2019, it meant that centres weren't being audited, so there were no real quality controls. Students then assessment centres, instead of applying to DSA QUAG to open a centre, were applying to DFE, and it seemed to be a sort of tick box exercise. So initially there were 69 main centres and a total of 256 centres, I think it was. And then once the tender was announced, that dropped to 66 main centres, but it increased to over 1,000 outreach total centres. So a lot of existing assessment centres, some of which have been going for 35 years, were finding that they were losing business because there was so many other centres had a postcode log on the postcode search. And as a result, a lot of assessment centres have gone out of business.
And are you also suggesting that of those 1,000 new ones in various different postcodes and so on, there was less quality control than perhaps there had been previously?
Yes. Yeah. A lot of them were doing telephone assessments, which of course COVID facilitated. So Zoom assessments, telephone assessments. But to date, as far as I'm aware, since the tender was announced, there's been some 40 main centres have closed or are in the process of closing. So that's not only going to impact on existing students, but also on students who are funded by other funding bodies.
And those main centres, was this the only thing they were doing, or some of them doing other work as well in terms of supporting people with apprenticeships and other bits of...
Some of them were doing other work, but the SLC and SFW formed the main bulk of what they were doing. So there's assessors and assessment centre managers have been made redundant. I know of a company who's had to make 31 people redundant because DSA assessments was the main bulk of what they did.
There's a knock-on impact of those closures as well for universities. So a number of universities would have assessment centres that were part of the university structure, or they would work very, very closely with commercial assessment centres, but that were based on campus or near to campus. And the interplay between the university disability and inclusion support teams and those needs assessors meant that a lot of the workload in terms of students coming back where there were difficulties with their support, understanding where to go for signposting for complaints, in terms of where they were having difficulties with suppliers, those types of queries, those types of challenges that students face were being picked up by both the university staff and that headcount of needs assessors. Those needs assessors and also AT trainers that were university staff might also have a dual role within the assessment centre, the AT department and the university disability and support staff team. So what the universities are seeing is a loss of headcount, but also an increased workload as a knock-on effect of these reforms and the poor communication around how they're being delivered.
And is there any indication that some of that workload might be temporary whilst the reforms are being introduced and might then go away when the contracting process is properly in place, or is that...
It's very difficult to say. In 99 there was a HEFCE report, Higher Education Funding Council. They said that for a minimum standard, a base level of support in terms of inclusive practice, there should be a ratio of around 200 disabled students per one disability practitioner. Last year, we commissioned some research from our membership, and the average is currently 583 disabled students per practitioner. 22% of our membership said that actually it was 750 disabled students per disability practitioner. Now you've got post-pandemic changes, you've got 1 in 6 students now disclosing a mental health need, you've got an increase from the time of that report of 3% disclosures amongst disabled students to 1/5 of the student population disclosing a disability. And you've also got NHS, local authority waiting times and the ability to actually get evidence and support in the community. So all of these things have an incremental knock-on impact on the university's ability to provide that base level of support. Mm-hmm. If you have these changes on top and their attention is drawn towards supporting the DSA-funded students, the population of students as a whole with disabilities are also impacted, of which there's about 450,000 compared to the 80,000 DSA-funded students.
And can I just come back to the point you raised about face-to-face versus telephone calls? Now, inevitably, the pandemic will have driven some of that, but what was the proportion of these assessments which were taking place before the pandemic, and to what extent has it returned to that or not?
It was probably 95% plus were face-to-face. Obviously, during COVID, we were still finding that some students wanted to do face-to-face assessments, and as long as it could be done safely within the institution, that was still happening. So it did certainly drop. However, we understand that at least 70+% are now remote, and assessments are being done by telephone. Which in the DSA1 letter, excuse me, it tells the student that they can be assessed face-to-face, remotely or by telephone.
And that change in terms of the number of main centres presumably means there aren't as many places for face-to-face assessment available, if you think of the spread of universities around the country.
I'm not sure there would be a difference in the number of physical locations, because the 1,000 could be just a postcode. Yeah. They weren't all necessarily able to offer face-to-face. In fact, we know a lot of them weren't offering face-to-face. So, but Student Loans Company haven't released the numbers or the locations of the physical centres that the new incumbents have, so we don't actually know how many there are.
And sorry, for your VI students? Is face-to-face assessments particularly important or less important?
I think the option of having that face-to-face assessment is really important, or particularly if it might happen over Teams, and that's fine, but most assessment centres as well, they should be offering the opportunity to try out a lot of equipment. So for blind and partially sighted students, the two parts of the budget, there's non-medical help and then the equipment. For blind partially sighted students, quite a large sum of their budget goes on purchasing equipment, so it's really important to understand what the right equipment is. And then for our colleagues at National Deaf Children's Society, where they support deaf young people, a large part of their budget goes on non-medical help. But it's really important to have that quality assessment, which is that question that you asked about, are they working, is it too early to tell? I think it is too early to tell, but at a meeting yesterday, there were some figures from Student Loans Company in terms of the time of the journey being much shorter now for end-to-end, which is great. But our question has always been, through this whole process, is what about the quality of those assessments? So something might be happening much quicker, which is great, but actually are people having face-to-face in-depth hour-and-a-half assessment processes? Are those assessments that are going to Student Loans Company of quality? Are the staff in those assessment centres trained, and do they have a proper understanding, particularly for our group of low incidence disabilities? And I think that's all of the questions that we would like to be answered. And when you look at now, there are some KPIs put in place as well as part of this whole process, which is great. It means there's accountability to the suppliers, but actually those KPIs are all very process driven. So in this time frame, you will receive your DSA2. In this time frame, you will receive your equipment, which is great. But there's nothing around what that quality of that journey is.
Get the right equipment, fundamentally.
Yeah, exactly. Yeah. And so that's what it's too early to tell. And just the other thing that I think also to say is these changes that are being measured and reported on are those students that have applied for DSA after that date. There's the whole load of students that applied before that date that aren't part of this system, so they're being picked up by Student Loans Company. And so those are all going through that journey, and those are also coming back in for assessments. And we have heard from, particularly from one student who's gone back in for an assessment because she's had change of needs, and he's waiting a really, really long time. We spoke to Student Loans Company about it, and they said that this student should have contacted Student Loans Company and not gone back to the assessment centre. But how is the student supposed to know that if it's not being communicated to them? So we're really concerned as well about all of these group of students that aren't part of this new system and what's happening to them, and to make sure that they're also being reported on and their journeys being monitored.
And is there a plan to transfer them into the new system at some point?
My understanding is no, not at this moment. Obviously, as Lesley said, there's this year plan of transitioning into it. So at the moment, they're being picked up by Student Loans Company. But there's been such a lack of communication to students about what their journey is, what their experience should be, what they should expect. And that's something we're really concerned about as well, about these changes.
And in terms of who should be communicating to those students, is it the Student Loans Company that should be taking the lead in that, in your view, or the department, or who should be leading that process?
Yeah, I think both. I think there should be, and we did discuss it yesterday, and there has been some, they said it's part of their work plan, where there should be communication to the student that you apply for DSA, this is what the process is. When you receive a DSA1 letter, this is what it is. I mean, who knows what a DSA1 letter is unless you already work in the system? This is what you should expect. This is what an assessment is. And they've always been quite reluctant in sharing that information with students. And I think information is power, isn't it? And then they'll know what that journey looks like for them and what they can expect.
And Sarah, I saw you shaking your head earlier when we were talking about quality. You might want to expand on that. But also, how have disability services and higher education institutions, you've already talked about the staffing challenge, but how have they been affected by the changes so far?
So if I pick up the point just about the KPIs and the quality data first, the data that was released yesterday that looks at the KPIs for time between point A and point B in the journey are a sample of students that have gone through this new process and have completed it end-to-end within the maximum of 50 days that they could possibly have completed that in. It's being compared to data that covers all students for an entire academic year that could have taken that whole year to go end-to-end through their journey. So taking the averages of KPIs from a small sample that could only possibly have a maximum of 50 days and comparing it to the last 2 years of full year students is not like for like in terms of deciding whether this has been a success so far and won't be like for like for a considerable amount of time. I think one of the main things that we would all like to see from this inquiry is that there is a time point, maybe at the beginning of 2025, once students have started their academic year, once disability support services have had a chance to see what the impact is on the students and on them, and that there are genuine quality measures as well as measures of impact on those students to really see what the impact of this reform has been. Because until we get past that peak in September, October, November, we're not going to know what the impact is of this, and the timing. I appreciate why this is happening now, but the timing doesn't lend itself to actually understanding whether there has been a success.
Okay, thank you. And why, I mean, we've seen some coverage of Cambridge opting out of some elements of this process in order to provide its students with better support. I think a number of other universities have sort of considered doing that. Why do you think that is happening? And is that related to these changes? Or was that something that was actually happening already in some respects?
It was happening to a degree previously, and the challenges that students and universities were having in terms of the application to DSA, the evidence requirements, the lead times, those challenges that were being faced were actually costing more for the universities and ultimately for the students than if the universities were to put that provision in place itself. But I want to make it clear there are only a very small number of universities that have the budget and can charge the tuition premium to be able to do that. And the majority of universities are not in a position to do that unless there is some other form of funding. And you also need to consider that there are further education colleges that have degree courses with 1 or 2 students on that are absolutely not in a position to understand how to do that. And with the closures of local provision for needs assessment and for non-medical help, that makes it even more difficult for those universities to contract out that level of support. And then finally, there is now a call for evidence for the non-medical help part of the DSA process. That's going to have an even larger impact on those universities, and it is likely to come at a time where changes are made before we fully understand the impact of this set of changes, and when most of the experienced staff have exited the market, and then there's a call for universities to need experienced staff in order to provide appropriate support for students. So there is a layering effect here, and we can't really see that at this point.
Andrew.
Given what Cambridge has done, if all of this government funding was simply divided to each of the universities on a pro rata basis and they all actually got the funding directly and got on with it themselves, and all this whole system was just abolished, wouldn't that provide a better service to disabled students?
Pros and cons.
Yeah.
So again, you've got differences in terms of the volumes of DSA of disabled students in universities, and differences in terms of the financial ability of those universities to put appropriate support in place. And there is a danger there. You don't want universities to be incentivising students to disclose a need that they might not otherwise disclose in order to draw down funding. And you also don't want that funding to come with some caveats in terms of it must be spent in this way, when universities have such diverse needs in terms of how they should be spending that funding. So essentially, yes, if that funding was locally utilised, then yes, a lot of universities would agree that that would be the appropriate way to go, but it would need to be carefully thought out, and it would need to be that those universities had some flexibility in terms of how they utilise that funding.
Can I just pick up that point just from in terms of low incidence disabilities, particularly around blind partially sighted students and also deaf students who out of the groups tend to reach the top end of the budget and have very there might be very complex needs. So if you're somebody with a vision impairment and you are studying a STEM subject, the type of support and intensive support you would need is very different than if you were studying an English degree. And when we speak to students, one of the number one questions we have is, could you recommend one university over another university? And we just simply can't, because their level of vision impairment, the experience that they have in different departments within that university, and also just picking up that about universities that may be really specialist, so music or drama or something like that, that just don't have the numbers. Our concern would be ensuring that that student is able to access all of the support that they need, and it's not based on budgetary kind of limitations that they have, because blind and partially sighted students and deaf students can be more expensive than other students. So I think there would need to be a lot more work in terms of mapping that out before we would say yes or no to such an approach.
And to give you an idea now, a student who is deaf, for example, whilst they receive disabled students allowance funding for those aspects of their support that the university might not provide as standard, universities typically still top up that pot by about £100,000 per student, because of the need for sign language interpreters, because of the need for additional equipment, and because of the lack of local supply to be able to support that student's needs. So whilst DSA pays a small proportion of what that student needs,
putting a lot in anyway.
The universities are already spending a lot, particularly on those students, but on DSA-funded students in general.
Thank you.
Can I just put in terms of devolving it back to the universities, what that actually used to happen years ago, not on a big scale, but a lot of local education authorities who administered the DSA at the time were happy to take recommendations from disability advisors. If that were to come in, you would need the expertise in every single university, the technical expertise, to be able to recommend appropriate assistive technology devices. To go back to Tara's point,
different conditions. And
when I first started in this field, one of the first students I assessed had already been assessed by her disability advisor, had got some equipment through the DSA, which was totally inappropriate for her. And we had to go back to the local education authority and say, actually, we know the student has exceeded the budget, but we need more because she was inappropriately assessed.
Thank you. Nick, can I bring you in?
Yeah, thank you. Is it the most important thing here, surely, from what you've just been talking about, is the quality of the assessment in the first place? Is that right? Yeah.
Yeah.
And so how do we get that assessment there? And are we doing a lot of assessments over Zoom and not in person? And is that creating problems too? I don't know if anybody wants to take that up.
It can create problems because while you can demonstrate equipment or some equipment over Zoom, there are others that you need a hand-on approach for. Ergonomic equipment, for example, some of the VI software or hardware. So it can be problematic. The other thing that's driving this reform is cost. They want to drive down costs. We don't know what the assessment costs are going to be, but we understand they're about a third of what they currently are. And we feel that it's not going to drive a quality assessment process because assessors are going to try, and the new suppliers are going to try and get as many through in a day as they can. So we do feel quality will be affected both by the time limitations and also if it's a telephone or a Zoom assessment, it doesn't suit all students.
One of the things that we have learned, and it's anecdotally because this has only been up and running for a matter of a month and a half, one of the things that we have learned recently is that there is a KPI around the number of assessments that are approved and that aren't there pending and that there isn't a challenge on. And what we're finding so far is that those assessments are coming through and they are being edited centrally by a quality or a review service within that supplier's framework before reaching student finance, which means they have a higher likelihood of approval, but they're not an accurate reflection of what the needs assessor actually determined would meet the student's needs.
Who's doing the editing?
So the needs assessor would put in recommendations, But centrally, there would be a review process before that recommendation goes to the SLC for approval. And if there is a risk that there could be challenge, it could be pending, more evidence could be needed, it could influence that lead time from point of assessment to point of issue of the DSA2. By putting a KPI in there in terms of that time frame and in terms of the percentage approval, you're incentivising those suppliers to streamline those assessments to only things they know they're going to get through. And that is going to shape the market in terms of what products are available. It's going to also mean that those students aren't receiving support that's fit for purpose. It's going to put extra pressure on the university disability support teams, and it's going to end up with those students going back round the circle again in order to receive support that is appropriate.
Can I just say to that, you know, if that is let's say an unintended consequence of what's happening, that is something that as an organisation we would be deeply concerned about, because part of the assessment process is that the student should see that full assessment and should be able to okay what's being recommended. One of the things that we've heard time and time again in the old system was from assessors that they would make recommendations for blind and partially sighted students that would be then rejected by Student Loans Company. Student Loans Company and DFE would constantly tell us as a charity, well, that's not the case, we wouldn't do that. And so we've got two different teams saying different information, and at the end of the day it's the student's experience in that. And actually sometimes with students, particularly with vision impairment, you do need to sit outside the box. So for example, there's a student at the moment who's come back into our service who was being recommended equipment that was wholly not adequate for their needs for the course they're doing. So we've been able to support them, and they're going back through the system now to get that right support in place. So it's so important to do that quality check at the beginning to make sure that a student has the support and the right equipment. And it will also save money, because sometimes if you are recommending the wrong equipment to somebody with vision impairment, all it's going to do is end up in a drawer and it's not going to be used, and then they're still going to struggle in their studies, and then we need to get involved. So just
most people going to university with visual impairment will have been through school or college with a visual impairment. So is there not a case for passporting what is in their EHCP or what they may have had support from elsewhere in education into what they do in university?
Yes and no. So students with a vision impairment are, out of the SEND group, are the lowest numbers with an education and healthcare plan, because of the support that's in place. Not all of them will need an education and health support plan, but also there are issues in post-16 education which we could do a whole different discussion about, where they don't actually get access to the equipment that they need. And I think it's really important to have that quality discussion before you go to university, because what you think you might need isn't actually what you do need for that course, where you're learning at a much more complex level. There's a lot more critical thinking. You need to access, so you might be using a piece of software that was okay when you weren't doing that, but now that you are, actually you need to have JAWS, or you need whatever is in place. So I think that there is, but I think we need to make sure people are getting that right support at post-16. So I think this assessment, our message is that DSA is so important. It is the difference between someone staying in university and dropping out, and it's so important to get that support set up when that student starts university as early as possible. And it's so important, as you said, it goes back to that quality assessment, taking the time and getting it right. And unless we are measuring that as part of these changes that are coming in, then we can say these changes are a success because KPIs are being met, but it's not a success for the student because they're not getting the support they need. And I think that's the crux for us, is what are we measuring success on? Are we going back to the student journey and making sure that's right, or are we going down where we're driven by processes and KPIs?
And I think the issue is that the students, and most of these students, will never have had an assessment before. So this is their first assessment. So they don't know what a quality assessment looks like. They come out the door after half an hour telephone conversation being told they're getting a laptop and training and XYZ. So for them, they might think that's a good outcome, but we wouldn't think it was a quality assessment.
The same would also be true of the AT training provision. So just because that AT training provision happens quickly doesn't mean that is the best thing to meet that student's needs. Again, hasn't been shared widely, but I've had sight of a document that says there will be minimum requirements in terms of the training for a needs assessor and an AT trainer and the CPD, whilst it's really promising that it stipulates there should be 25 hours of CPD each year, it's incredibly worrying that the minimum requirement in terms of an understanding of disability is that within 6 months of being employed, somebody has to have basic disability awareness training. And that's it. So most of our AT trainers, most of our needs assessors that were in the sector would have had extensive knowledge
already.
And naturally, there would have been those providers that were understood to be of a high quality and the universities would have signposted to, would have contracted to, and the students would have preferred, and those that weren't necessarily. Now there isn't a choice, and my understanding is that somebody could be working with students for 6 months before having a basic level. So that level of quality, I think, needs to be looked at very, very early on.
Does the assessment continue throughout the course over or is it just an initial assessment and that's it for the entire length of the course, and then the course is 3 years, or is that how it is?
It's an initial assessment unless there is a need or a complaint or a change in circumstance that's identified, and then that student can go back. And obviously those students that are already in the system would have gone back to their original needs assessor, and now that's not a thing that they can do, so they're now going to be going back to a supplier that they've not worked with before.
We're concerned about it, which is one of my questions. Are you concerned about it? And you obviously are, but until you actually get the data, maybe in a year or so's time, you're not going to. But I mean, is there anything now that we can actually do, or is there anything that we really need to be aware of that you can see is just glaringly obvious? This is going to be unhelpful.
I think if we had more information from SLC, part of the issue is we don't know how many physical assessment centres there are around the country. We don't know the locations of them. We don't really know the guidance. No guidance has been given to universities or to students. Some of the letters that are going out to students still contain old information. If you need any update, go back to your disability advisor. And the disability advisors haven't been told what to do either. So we need more information from SLC.
And how are you communicating with the ones that are already in the system? Is that something that, or who's going to do that? Because you said there was a concern about the ones that are already in the system, not the ones that are actually starting. So what's your thoughts on that?
It is difficult because previously, and to go back to your previous question, an assessment centre has a responsibility for a student throughout the lifetime of their studies. If they go back for just an increase in NMH hours, for example, then you can just make that recommendation to Student Loans Company. If they want a small extra piece of equipment, again, you can make that recommendation. There are certain circumstances that a student can have a full review that is funded by Student Loans Company. So at assessment, students were always told, any issues, anything different or additional that you need, come back to us. We're now having to say to the student, only because we've sort of picked it up as we go along, you now have to go back to Student Loans Company. And they will.
The assessment centre might not be there.
That's correct. If the assessment centre is still there, then the assessment centre will deal with it. But if the assessment centre has closed, then they have to go back to the SLC. And we have asked, both for disability advisors, we have asked for a list of those centres that have closed. And we haven't been provided with that. We know there's about 40 centres out of the main 69 that have closed. But we don't actually know which ones, and disability advisors don't know which ones.
The practitioners are sitting in the assessment centres. Yes, the practitioners are sitting in the assessment centres. That's where they work.
Or the universities in some cases. But
Or the universities.
But if the assessment centres have closed, where are these practitioners gone? I mean, and there's obviously a skill there that's been...
There's a massive level of skill and expertise that has been completely lost to the sector. Some have found jobs within the sector, but I know of colleagues who've had 40 years of service within a university who've been made redundant. So a lot of assessors and assessment centre managers have got jobs elsewhere. Some have got jobs as disability advisors, but others have left the sector altogether.
Andrew, can I bring you in?
Yeah, well, you've touched upon this already, so I know the answer, but the question's still worth asking, which is about whether or not the Student Loans Company took sufficient steps to consult with you, with other stakeholders, with students and student bodies, and if they did or didn't, how did they, what did they miss in terms of not speaking to you about designing the reforms and implementing them, and not just in terms of ahead of introducing this, but in terms of ongoing and implementing the change to the systems as well?
I mean, I can talk from a charity point of view. Obviously, it will be different for my colleagues. So there was a number of consultations. So Student Lanes Company did a piece of work where they spoke to a number of different students and they plotted the journey and identified these pinch points. And they had 2 projects they were going to do. One project was about how they could change their systems and be more accessible as an organisation. And the other one was around this journey around for students. So the number of different charities were consulted on, the reports were read, recommendations were made. We were also invited to be able to input to the quality standards, and then we were told we couldn't input into the quality standards, that they would be driven by those that would be awarded the contracts as well, which we were slightly concerned about. Then it went through the procurement process, where it went very, very quiet. So all we had was updates, and as we said, there was delays in implementing it. Then we only had our first DSSG meeting yesterday in terms of getting some of the updates on it. So some of the consultation with students was there. Some of the consultation with the charity sector was there. But then it just all went very quiet, and we don't feel like we had that chance to shape some of the stuff that's come out of the end of it. So so that's been our experience. And then what they've also said to us is that they were setting up a DSA quality committee, that when these changes come in place, that committee would then be able to scrutinise the providers and ensure that the quality framework was being implemented. But actually that group is very small in numbers. It's not had a chance, it's not to scrutinise much, but also it doesn't really understand where its barriers are, what the powers are, what the group can ask for, what its remit is, what its remit isn't. So it feels slightly tokenistic at the moment, and probably not all the people that need to be around the table. So again, that's something that we were told is happening, but it just needs a little bit more thinking through.
I think part of the difficulty is because this was a procurement tender. Anybody with a commercial interest couldn't participate in those discussions about shaping the service, which means any needs assessor, needs assessment membership group, needs assessment centre couldn't be part of shaping what that service would look like. Universities that have needs assessors, that have AT trainers, obviously have a commercial interest, and those suppliers, non-medical health providers, etc., within the sector have a commercial interest. So whilst we have a quality group, the people on the quality group aren't necessarily those that would have first-hand experience on the ground of what quality might look like in a one-to-one session with a student, for example. They would have the overview, but they wouldn't have that practitioner experience necessarily.
Yeah, I mean, that was our experience. There was very little consultation with existing assessment centres as to how to shape the new tender. We didn't know that it was going to be a combined tender until it was announced. And in terms of the quality standard, we have offered to be involved. We were involved with the DSA QAG. The first quality assurance framework was drawn up in conjunction with them and NNAC members. So, and over the years, we would refine it and say, well, that's not working because...
And it was visible.
Yes, and we've not been given the opportunity because our members have a commercial interest, but we feel that that's where the expertise lies.
Nice, thank you.
Thank you. I think we're going to need to bring in the next panel, but can I just ask before we do, in terms of that combining of the 2 phases, obviously your members, Lesley, were very much focused on the assessment. What do you feel are the risks in combining the 2, the assessment and the provision? Or are there upsides in that in terms of streamlining the process? Where's the balance of that?
I think certainly there's the upside of streamlining the process. However, I think there's definite conflict of interests where if you've got an assessor who's being told by their organisation that they can only recommend certain pieces of equipment or certain pieces of software, not to make the reports too long, use this report format. They're not going to bite the hand that feeds them, so they're going to do as they're told. And similarly, the equipment suppliers of that organisation might want the assessor to recommend specific things. So there's a risk of it stifling innovation and reducing the amount of software and equipment that is currently available to disabled students.
Anything to add to that? In that case, no.
I suppose the benefits is about actually doing some tracking of end-to-end journeying, though bearing in mind it's not the end-to-end journey for all students because it doesn't include non-medical help. So there's those benefits, but I think it just goes back to that question of that stuff could be overcome if we ensure that you have quality assessments that are being carried out by experienced, knowledgeable assessors, or that you have processes in place to make sure, and that you're not driven by numbers and turnover of students going through the system. So that, for me, is the biggest risk. And also the other risk is that without addressing these changes and telling students what they can expect, there is that concern, and we have heard it, that they're just not applying for DSA because they're worried about what's going on. So sometimes no information actually is more scarier than them having the information.
Yeah.
Thank you. I think it's been a very helpful panel to prompt some of our further questions. Sarah, did you want to make a concluding comment before?
Just one thing in conclusion. I think the timing right now, we cannot see the full impact. I think it's essential that there is a review from a quality perspective and from an impact perspective on students and on the wider sector prior to the next phase of any DSA reforms, because of that incremental impact on both students and on the staff. And as you highlighted, a lot of skilled staff have left the sector, and then new reforms are coming in, which means the universities are likely to need those skilled staff, and we're going to be right back to square one. So I think one of the recommendations I would make is that there is a point in time that's determined where we can feed more evidence in and collect that evidence.
Yeah, thank you. Thank you very much.
Thank you so much.
The proceeding is currently suspended. The proceeding is currently suspended. The proceeding is currently suspended. The proceeding is currently suspended.
Laura Blackman, Managing Director, Education Programmes at Capita, and Glenn Tookey, the Managing Director of Study Tech. And so I'll hand over to Caroline to open up on this.
Thank you, Chair. So straight in. What do your new contracts with the student loans company require you to deliver? Glenn.
It requires us to deliver an end-to-end service for the student, covering needs assessments, equipment provision and support, and training on the technology that we deliver for them, and then aftercare should they need any help during the length of their course.
Before I come to Laura, may I ask, one of the points raised in the previous panel was around, you said end to end, but there was very much a feeling that the betwixt and between experience, the burden, the administrative type burden, sat with the student. How might you sort of respond to that? Do you recognise that?
I recognise the burden that there was on the student before in terms of going backwards and forwards between different suppliers who weren't necessarily connected together. But that is not the way in which the new restructuring will work. It's not the way it's working right now as we've started the new service. We're advised that the student has been approved for disabled students allowance, and we know their name and their contact number, and we get in touch with them and we start the whole process there. From that point, we handle them end to end. We make the connection with the student. We don't have to wait for them to contact us, as has been the case before. And from that point, we handhold them, and our system, which is an end-to-end system for ourselves and all of our subcontractors working on the contract with us, advises each different point in the process of the needs, details, contact numbers, requirements for the student, so the information is passed end to end. There should be very, very little need for a student to be chasing us around now. It's now down to us to chase them around to give them their provided services.
Thank you. Laura, same question.
Yep, so the only things I'd probably add to what Glenn said is, the student is at the heart of what we deliver. We very much work for them delivering this service, reducing those handoffs, taking the kind of admin burden and stress out for them, and making sure, that they've got the kit, the support, the training they need, ideally before they start their studies.
So also in your experience then, in terms of the delivery of the contract, it's not the start and the end, if you will. There is support all the way through the sort of assessment process. So in terms of targets then and key performance indicators, how do they line up?
Yes, so we are measured against a series of benchmarks and performance measures. There's 23 different KPIs in the contract covering kind of the full end-to-end of the service, so everything from the provision of the needs assessment to the delivery of the kit and any assistive technology, right through to our compliance with commercial standards as well.
In terms of those KPIs, are there KPIs which sort of directly centre on sort of quality as well as meeting deadlines and the like?
Yes, the KPIs cover the kind of the end-to-end service. We're focused on quality, we're focused on student satisfaction and making sure we're delivering the outcomes that Student Loans Company have asked us to deliver.
Does that include student outcomes? Because my concern a little, this is obviously a new system, there's some discussion around how it's playing out. Is there an inherent design flaw? Is it an implementation sort of issue? Is there a focus on student outcomes? Because for sure, in this early time when there isn't the data or the feedback, a cohort of students will have been impacted and affected. Some maybe not, but others yes, and some perhaps quite significantly.
So the KPIs don't directly cover student outcomes, but student outcomes are kind of at the heart of what we do. So we have established an advocacy group, and that will be comprised of 10 different members representing a range of views and disabilities across the sector. So we have organisations such as Disabled Students UK on there, and we use that advocacy group to really kind of challenge us, be that critical friend, make sure we understand the sector that we're delivering, give us guidance on trends in the sector as well. And early feedback that we've got from that advocacy group has kind of suggested some areas that they'd like us to focus on throughout the delivery of our service. And one of them is the service, doing what it set out to do? So are we helping students stay through the course of their studies? Are we helping students at the end get into employment? So that's something we're really interested as an organisation in working with the Student Loans Company to explore how we can use our service and the data to measure those outcomes.
That sounds very positive. Is there anybody in the system who's looking at the individual student and seeing that they are reaching what would be considered their potential, looking at sort of projected levels or anticipated success? Is anybody looking at that then, if that doesn't fall directly within your remit? Who has that?
Yeah, I'll pick up that because firstly, some of the key performance indicators do measure student outcomes. We measure failures, we measure complaints, so we measure the high level, are you meeting the service? But then we have quality management systems, we have ISO 9001, 14001, 27001, so we have systems in place that allow us to measure every single failure in our business, and student outcomes is clearly part of that. Students give us feedback all the time, that gets fed into our monthly quality management reviews, and we look at every failure, whether it be a component failure, whether it be a communications failure, whether it be a failure to deliver to the student. Actually part of our system, and we've all got, it seems, extra parts to our system beyond what is contractually required to make sure we manage quality. And in ours, right at the beginning of the process, we measure what the student perceives their attainment level to be and their challenges to be as part of the pre-assessment reviews which go into the needs assessment process. Now we're joined up, we can work that all the way through the system, and when we get to the training part of the process, which is right at the other end and can be even 1 year on from delivery of the student, then we're measuring again, see what the student thinks of the service they've had and how they see their attainment and their capabilities now. What we're really hoping for is to, over the course of this contract, to be able to show that we positively affect a student and that we do meet their outcomes, and hopefully that DSA, not just what our company Study Tech has delivered, but that DSA end to end has improved their position at the university and their attainment in the future. So we do measure it.
Very last question, a sort of logistical, really technical question in terms of how you measure. Is this a sort of dashboard? Is there a team? How does that part of the process work in terms of the reporting and the analysis of some of the performance data?
Yeah, ours is collected externally and internally in our systems, in our quality management systems. So we have a database which pushes every student through. On every student account and record, we have information about that we've learned about them all the way through the process, which is something that the new system allows for that the old system didn't. It's joined up, so if the assessor has a concern, they can pass that through, and the trainer now can pick that up. In the old system, a trainer would pick up a student and would not even know what their conditions were necessarily. Now they do know all of that, and we also pass that back to the higher education establishment. If we have a complex case or a student that needs support, we can now connect straight back to that because we have that information in our system. So we connect it, we log it, and I, as managing director, review that monthly to see exactly what sort of feedback we're getting and where it's working. So it's beyond just the numbers and meeting the turnaround. It's about the quality of the delivery of the service as well.
Is there some qualitative data as well?
It's qualitative and quantitative, yeah.
Laura, anything further to add?
Yeah, very similar. And we meet regularly with the student loans company as well to review that data. You know, it's very early days, as the previous panel mentioned, but already we're looking to see if there's any kind of trends, anomalies, things that we need to address. We also attend a joint supplier forum where we share data between our organisations, best practice, lessons learned. So again, we're trying to provide a consistent service across all geographies.
Thank you.
Thank you. Nick?
Just with regards to the targets, what success actually look like? When do you tick that box and say that was exactly what it should look like? What time period is that over, roughly?
Success is probably broken up into lots of different time periods that then connect back, I guess, to one big time period. It looks like at the beginning, have you connected with the student very quickly within 24, 48 hours? Do they get their needs assessment booked in the way they like, face-to-face if need be, or remotely if required, within a certain timescale? Did we deliver their equipment to the specification on time? Did we get their training? How much of their training did they take up? One of the challenges with the old system was that very little of the assistive technology training recommended actually got taken by the student. We now have a system in which we make sure that they understand the value of training and take more of it. So you can take all those small measurements and put them together at some point in the future and say end to end, did students, did it work? Did the system work? Were there less failures? Is the student satisfaction better at the end of the new process than it was in the old process?
The previous panel was talking about the actual quality of the assessment. So are you going to make sure that your assessments are where they should be? And are you going to do as many of these in person, or are these going to be Zoom? Or because obviously, I mean, it's a commercial outfit. You want as many as going through as possible, but obviously it's the quality of the assessment that we heard that really, really counts. And I think there'll be an awful lot of students where you really do need to see them face to face to actually get that real feel of what's best for them going forward.
So nothing's changed about the assessment process. The actual end-to-end system has changed, but we still get, provided that a student needs assessment, they still get an assessment of 1.5 to 2 hours. Certainly in study tech, 85% of our assessors are existing assessors from the old system. We have actually people assessing for us now who have worked at different areas in the assistive technology market or process or industry, and we're retraining them and using the skills they had to put them into the assessment system as well. So, CPD, that was picked up earlier in one of the discussions. Our tender submission, and it's one of our KPIs that we're looking to achieve, is that every assessor has 25 hours of CPD a year. No assessor actually connects with a student unless they've had the relevant training. So I believe that the assessment process that we offer is at least as robust and certainly has every single piece of quality. We haven't lost the skills necessarily from the sector, we have retained them. What I think is different about the sector now is there are fewer assessors doing more assessments rather than...
Does that mean they're doing more remotely?
Well, when we got to the height of COVID, remember every assessment was remote. We're now only a few weeks, couple of months into the new service. 20% of our assessments are now face-to-face, and that's slowly growing. In terms of closing of assessment centres, of course, there was an explosion of assessment centres through the COVID period in the last couple of years. But Study Tech has 40 assessment centres open currently, 20 in Zone 1 and 20 in Zone 4, and we're building that. This is the lower volume time of year. And we are also working with HEIs to re-establish assessment centres inside higher education establishments. We've got formed an orderly queue of people who would like to retain assessment centres on site, despite the commercial model being slightly different now. So I think that we have already put a process in place where students can be seen face-to-face if they need to, and that we are using existing assessors who are experienced. And it's not a numbers game. We have resourced ourselves to meet exactly the numbers forecast for the service, 30,000 students.
I'll come on to you, Laura, in 2 seconds. So you do believe that you're resourced enough to carry out the works that you need to do?
Absolutely, yes.
Yeah. Laura, similar questions, really.
I think just to add, it's student choice, which is at the heart of the service we've designed. So it's up to the student how and where they want their assessment completed. We can do that face-to-face, or we can do that virtually, either via a Teams meeting or by the phone. So we are neutral in how a student kind of conducts their needs assessment. We share with them the benefits and advantages of each route and really work with them to do what's best for them.
I think, just my opinion, and it is only an opinion, but I think if you offer an easy route for people, then they tend to take it, and if they can do something over Zoom, then quite often they'll do things over Zoom. That doesn't mean to say that it's the best thing for them. And I think it'd be interesting to find, and maybe you can test and measure this, are your outcomes been better with those students where you've seen face-to-face or those that you've only seen on Zoom? And I would personally encourage us to see as many people as you can face-to-face, because I think you just learn so much more about them. So do you believe that you're adequately resourced, Laura, and how many assessment centres have you got across the UK?
Yes, we've ramped up our needs assessment team, so we're now fully staffed to meet peak demand, which we expect to see over the next month. We have assessors and assessment centres across the geographies that we support. We've got a number of different assessment centre strategies. So we've got a primary strategy, which is physical assessment centres located across Midlands, East Midlands, Wales, London, and we also have a secondary location strategy. So that means if those primary locations don't work for a student, we can flex and switch on accommodations closer to a student to allow them to do face-to-face. And if that doesn't work, we work with students and their HEPs to come up with a solution that works for them so they can have that face-to-face assessment. So there's a number of different routes we can take to support students.
Thank you.
Thank you. Can I just ask the same question that Glenn said, 20% and rising in terms of face-to-face assessments? Is that a similar figure for Capita, or is it a different quantum?
We're currently seeing 94% of students requesting a virtual assessment, but as Glenn said, that number, the number of students requesting face-to-face is increasing. It is still early, we are still collecting data, and so that's one of the kind of key things we're watching, where students want assessments and how they want them.
And where do you expect that, or where do you, in terms of your planning, where are you planning for that to end up? And you know, same question to you, Glenn. As you said, it's 20% and rising currently. What is your estimate of where you expect it to be on an ongoing basis when this is settled?
Our estimates currently are around 30% face-to-face, so that's what we're currently geared up to be able to support. But again, we're just monitoring trends and we can flex that.
Yeah, I don't have an actual estimate on where it will end up. Over the 15 years I've been working in the sector, it has risen to a peak and then dropped through the COVID and is started to rise again. I think the key thing is that we mirror our accommodation strategy to meet whatever the trend as a demand is, and I think we're ready for that.
I'll bring in Vicky.
Thank you. So, when I first started this job 7 years ago, I used to get really desperately sad correspondence from people who were going through the PIP assessment process, which Capita ran and Capita still runs. And when I say sad, I mean desperate. People treated as objects, assessors who had no view of the individuals, tick box exercises. I remember the first email was from a very disabled young man on the point of suicide because of the tick box way that this PIP assessment process had churned him out with inexperienced assessors and horrific wait times. And it was not uncommon for MPs to receive those messages. Now, I have to admit that over the past few years, I have not had those types of complaints about PIP. But I am really worried, given what we heard from the earlier panel, that you are going through this change very quickly, that it feels as if it could be that sort of tick-boxy thing again, that we risk losing some very experienced people. I hear what Lesley said about people with 30 years of experience leaving. What have you learned from what went wrong, so desperately wrong with PIP 6 years ago, and how you're doing it today, and how can you assure us and assure those students and assure the parents of families of often very vulnerable young people who are leaving home for the very first time that you are going to be there, that they are not going to be treated as tick boxes, and that they are going to get the support that they need at the time they need it?
Thank you for the question. So we are only 8 weeks in. Performance so far has been strong, and we've had over 5,000 referrals so far. And as I've said before, you know, providing a great student experience is at the heart of the service we've designed. We've got a very strong heritage of delivering needs assessments through our Contact Associates business, which has been supporting students for over 18 years. The majority of our needs assessors are very experienced, and they undergo rigorous...
When you say the majority, because we heard from this panel that somebody just needs to do 5 hours training at some point in their first 6 months. So how many have you got who are brand new and haven't had that training, and how many have you got that are absolutely bang on, massively experienced?
So 65% of our staff are experienced needs assessors. The others are new recruits from the market, and they are a mixture of experienced needs assessors that have come to us from other organisations and also new market hires. What we were seeing was training amongst needs assessors under the previous regime was a little inconsistent, which did kind of raise some quality consistency challenges. So all of our staff receive 4 weeks of intensive training. This is then followed by an 8-week speed to competency process, and during those 8 weeks all staff receive mentoring from an experienced needs assessor. Initially, new staff don't assess a full range of disabilities.
So when you say somebody's an experienced needs assessor, what's the minimum amount of time that they will have spent working on assessing the needs of somebody with disabilities?
They've got to have at least a year experience.
At least a year. And will that have covered multiple disabilities? Will you have somebody who's experienced in, for example, supporting people with hearing or sight issues?
So it can be mixed. So that's why our training process has been designed to ensure consistency across all of our staff. So all of our staff can assess the full range of disabilities. When staff join us, they are only able...
And what have you learned from what went wrong with PIP to make sure that we know that that's not going to happen again?
So the importance of data. So we're capturing how we're performing, we're reporting and sharing that transparently.
You agree with me that what was happening 5-6 years ago when I first started this job was completely unacceptable?
So unfortunately, PIP isn't within my remit, so I can't comment on PIP. What I can share about PIP is that, as you mentioned, claimant satisfaction
so this
has
question
improved.
about what lessons has Capita learned from its work providing PIP assessments on behalf of DWP that affect its approach to DSA assessments, that has been drafted by our clerks, who will have contacted you before coming here and said the committee is likely to answer this question. Capita have not sent somebody who's able to answer this question.
So I can talk about all of the things that we've done when...
We would like to have an answer to that question. What have you learnt from what went wrong, which we know was going wrong? How have you changed it, and how can you assure us? And if you can't answer that question, can I suggest you send that in writing?
Yes, I will certainly come back to you in writing. But, you know, we have experienced staff delivering this service. All staff undergo rigorous training, and we're constantly looking for feedback.
That's what everybody told me 6 years ago.
But also that point that we heard earlier about a sort of minimum requirement being training within the first 6 months, presumably you can assure us that that isn't going to be left as long as 6 months for someone joining.
Disability training happens within the first 4 weeks of staff.
And if you have an assessment, so somebody's coming in for an assessment, what happens if they have got very specialist needs and they need to speak to somebody about the type of reading equipment that we were just hearing about?
So we do engage with SMEs in certain instances, so we can reach out to the likes of Con Evans and Vision Aid, who can help us with our recommendations. They can provide guidance on specialist kit and equipment that may support a student. So we do have access to SMEs if we need them.
Have you looked at what types of equipment were being purchased before and what types of equipment you are now supplying, and whether or not it's equivalent range? Because what the previous panel said is that the way this is happening is going to stifle innovation, stifle choice, and mean that there is less ability to support these young people.
So one of the things that we're doing to make sure we're constantly innovating is
The answer is no. You haven't looked at what was being provided before and what's provided now?
We have looked, and one of the things that we're doing to kind of improve that, to make sure we're constantly innovating, is we do Tech Tuesdays, whereby we invite various different AT providers in to talk to our staff to demonstrate a range of equipment and services.
Are you providing as wide a range as students, when you look at what you are now supplying to students, is there as wide a range of different types of equipment as there was before?
Absolutely, there is.
Not just on what they could get, but what they are getting.
Yes, and that's one of the data points that we'll be collecting and monitoring, and we can report back on.
Thank you. I'll bring in Andrew.
Thank you.
Sorry, Chet, just before Andrew, but with the note that question was not answered and that we need it in writing. Thank you.
Yep, okay, thank you, Chairman. Wondered if I could ask you both, what proportion of your income from the contract is for needs assessments and what comes from the supply of equipment and support? How does that divide up? We'll start with you, Laura.
I'm afraid I don't have that answer to hand. What I can do is take it away and report back.
That would be very helpful, thank you.
Glenn?
Yeah, the proportion would be something like about 25% would be assessments.
Yeah.
About 60% would be equipment. About the remainder would be training. It's about 25% as well.
Yeah.
The equipment, the number of cases, of course, is pretty much the same. 30,000 flying end to end. It's just the value of each part of the. So in terms of revenue terms, is different, and there's more value in the equipment.
It'll differ from one case to another, presumably.
It's completely different, and actually we do measure exactly what equipment moves through the system end to end, and the scope of it is no different. So I don't expect the value of our contract and the movement of that to change dramatically over the period of this contract either.
Does that sound about right, Laura? I mean, this is, these two components of the contract are the main part of this contract, so you must have some idea how they divide up.
Yeah, needs assessments are, as Glenn identified, the smaller part, and then it's obviously student dependent and dependent on the kit and the assessment recommendations.
And how much do you charge for a needs assessment?
So that information I can get back to you on separately. What I can say is we charge a fair and reasonable price for those assessments. I think under the previous regime, providers charged the maximum possible allowance that they were able to, whereas now we take a very different approach.
I bet that's not what they'd have said. And who would come to this panel and say they don't charge a fair and reasonable price?
But I have heard, in fairness, that the charge of assessment is lower than perhaps it was across the piece previously. I guess the concern around that is that there are, and this, from my own talking to businesses in my constituency around this issue, there are some concerns that there's an incentive for someone with a very large chunk of the market to use the assessments as a bit of a loss leader in order to be able to make revenue on the products and that side of things. And Glenn nods, but how do you address that in terms of the overall value for money proposition?
Yeah, I mean, can I come in on that one, because I think that there's a danger that there has been a significant lowering of the value of the assessment, but we still make a positive return on every part of the service, which I think is where you're sort of driving. Is there a loss leader? Absolutely not. There's a profit margin, and remember, we bid for a contract now and have a guaranteed volume of cases over a 3 to 5 year period. The previous system, the previous model, you had to bid the lowest price to win any business at all. That was driving quality in exactly the opposite direction to which we now are at. I have a secured number of cases. I bid a commercially viable price to operate that service for a reasonable return, and it is much more stable for us as a business. It allows me to recruit people on long-term contracts, being able to offer them a guaranteed amount of work, which you couldn't in the old system, and it means I can invest in my business for systems and support and training for my people, because I know how many people I need, I know how much business they've got, I know what I need to train them on. This is a much more stable economic and commercial system that I operate in now than the one I did in the certainly last 5 years.
You referenced reference training there, and I just wondered what the package was for your assessors in terms of both requirements but also their continuing professional development, and how you're planning to make the most of the opportunity you say that this contract provides you with.
Yes, so as I said, 85% of our assessors are existing, experienced assessors from the system, so they all come to us with a set of skills. By the way, not every single one of our assessors can assess every single case, but their capabilities in the conditions that they are experienced and able to assess are noted on our system. They only get allocated a student where it meets their capabilities. So we train them in a number of different ways. We train them on technology, so they understand the new products and services coming to the market, because that's quite a rapid change, certainly in this market. So we make sure that the supply chain advises them. We work with disability awareness, charities and a range of third sector to make sure that they understand how to support students. We train them on the different condition types to make sure that they're up to speed with the latest thinking and the latest developments. And we support them all through our quality assurance and through our training services. And as I said, we've got a smaller number of people working more cases for us than before. So it's much more easy for us to identify needs and train and keep that workforce up to a skilled level than it was with a very fragmented, large workforce in the previous model.
And you referenced earlier on to using subcontractors or SMEs, and how do you, in terms of specific needs that get identified, and how do you keep on top of them and make sure that they're delivering services to the level you'd expect?
So we subcontract some of the assessments, and we subcontract some of the training. Most of the training and all the equipment is undertaken in-house. All of our subcontractors use the same system end to end. So it's not a set of joined up businesses when it comes down to the actual delivery of the operation. They all use the same system, they all have access to the same data. They're all back-to-back contracted to meet the KPIs, the 23 KPIs, and we measure them end to end and report that back to Student Loans Company as an entire end-to-end process. We don't hide any of the subcontractor performance outside of our reports. It's all inside. It's one system end to end.
Thank you. And so Laura, qualifications and skills, continuing professional development and assessing the performance of your subcontractors and SMEs.
Yeah, so very similar to what Glenn and Study Tech do. We've got a robust training regime that all our staff go through. All staff are required to do 25 hours of continuing professional development a year as well, and we have regular support processes throughout the cycle to make sure staff are on top of what they're doing. So each week we have a digital drop-in where staff can come, ask questions, get support, flag where they need specialist advice. They can get feedback and recommendations on individual needs assessments as well. So we've got a robust support mechanism around all of our needs assessors. From a subcontract management perspective, we've got close relationships with our two suppliers who deliver assistive technology, training and support. Like Study Tech, we have back-to-back contracts in place. We manage and manage them robustly against a set of KPIs, and we report on those as well. The only other thing I think we do a little bit differently is some of our needs assessors are also trained to do the assistive technology training as well. So they can really build that relationship with students and help them use the kit that they've recommended as well, which we believe will have big advantages as well.
I mean, obviously, this is very important to the students in question, and every now and then, given human nature, what people are given or assessed as needing won't match up with what their own assessment of their needs is. So what are both of your processes for appeals and complaints for students and getting some sort of resolution? And how do you balance rigorous appeals procedure with not being massively time consuming and getting mired into, endless exchanges of form fillings, etc.? Start with you, Laura, then you, Glenn.
I think, we really care about delivering a great service to students and making sure that they get the equipment and support to enable them to be as successful as they can in their studies. Where that doesn't happen, we have a robust complaints process in place, and it's a 3-tiered process designed to exactly that, help students resolve their issue quickly and not present an admin burden. So the first step is students can raise an informal complaint, so they can speak to their needs assessors, or if they're not comfortable speaking to the needs assessor about the issue, they can speak to that line manager. If that doesn't resolve the issue, they can then escalate their complaint. At the point of escalation, we will then conduct a thorough investigation into what's happened, why they may be unhappy, and we will write back to the student within 7 days around what we found and how we're going to resolve that for them. If that doesn't resolve the student issue, or they're unhappy with the outcome, they're able to escalate that externally to the student loans company via an appeal process as well. So quite a robust mechanism we've got there, but focus is on resolving quickly with the students at that first point of contact.
Thank you.
Yeah, we have a standard complaints process, escalation process that mirrors very much that of Capita, but I think it's about more than that. Our assessors engage with the students have the opportunity to review the report, the students have the opportunity to discuss the outcomes. We have a quality assurance process that's looking at the reports. The quality assurance process will pick up reports that we believe haven't covered all of the conditions accurately or at the level, and we'll go back to the assessor and to the student to make sure the outcome is good. Any student that has any expression of dissatisfaction rather than even a formal complaint is going to get picked up in our system and engaged with us, and we will manage them through the process. If we pick up later on in the process, probably not at the equipment, but certainly at the training, if any of their needs haven't been understood or accurately delivered, then we can feed that back up the process. That really is one of the benefits of this joined up system now, is that something we learn at the beginning can get to the end, and something we learn at the end can get back to the beginning. So I think it's more about how you embody just delivering a quality end-to-end service that gives the students what they're looking for, and not rely on a complaints process to tell you where you're getting it right and wrong. I think it's always been much more real time than numbers and mechanisms and reports and complaints.
There is that ultimate external student loan company recourse if none of that works out.
Oh, of course, yeah, that's in place, and we have regular forums, regular supplier meetings, regular KPI reviews with student loans company as part of the new process. We've only just started, so we haven't really got into the process of engaging with them. But there's a team of 3, Laura, ourselves and Student Loans Company. We're working together to make this a success. We do realise this is a massive change, and we've taken the whole thing and turned it up the other way, but we haven't broken it, and I think that's really important. As a last word from me, this is working reasonably well.
Well, two quick questions before we close this panel and bring in the Minister, who I see has joined us, so welcome. You heard some of the concerns around communication at the beginning of this session, and what do you feel you can take away to improve that process of communicating with some of the charities, organisations and stakeholder groups from this, and are you constrained in any way by the commercial arrangements with the student loan company on that front? And then the second question was, we also heard concerns around the cohort of people who haven't yet been brought into this process and the sustainability for them if their assessment centres that they previously had contact with might have closed or changed. Is that a cohort that you anticipate engaging with as this process continues and potentially bringing into it? Yeah,
well, let's start with the last question first. We're already engaged with students whose assessment centres are no longer there. There is a process, agree with the student loans company, Capita and ourselves, pick up the students based on the regions in which we operate, and we're already engaged with students who have come back to us needing a review of needs, needing more help, and their existing assessment centre isn't in place. So we're picking them up, we're operating them as if they are brand new students to us, and we are reaching out to get the information required to support them. So that's already happening. Remind me of the first question.
Communication and I guess the concerns of some of the groups representing disabled students and disabled student practitioners who feel that they've been a bit in the dark due to the...
Yeah, so we've always been connected pretty much with the third sector. Actually, the team behind us are all known to me personally and have been part of our communication process all the way through, particularly Thomas Pocklington Trust and their interest in the visually impaired and the blind, because actually my company, Sight and Sound Technology, which is part of the Study Tech team, is the UK VI expert in DSA. So we've been connected with that for many, many, many years, and that hasn't changed. And I think that we've also redoubled and reached out to the HEI sector, because clearly there's a danger that floats away as the new system comes in place and new relationships are put in place. And as I said, we've reached out and we've met 40 of the HEIs already since the start of the year to discuss the new reforms and new processes. We sent a questionnaire out and we've had 104 responses from HEIs, so we're working around them. So I think we've reached out to the front of the sector and continue our relationships that we've had for many, many years. Study Tech has been operating as an HSP for many years, as an assessment centre for many years, as a trainer of students for many years. So we think this is just a continuation of the work we've been carrying on, just in a different format.
I mean, I think you can take it from what we heard in the first panel, but the job is not yet done, and there is more work to do to reassure and to communicate in terms of the way this process will work. But Laura, anything to just add to that in terms of Capita's approach on communication?
Yeah, I think that's one of the reasons, we've created this advocacy group to bring in experts from the sector, to hear those different voices, to get that feedback and how we can better work and communicate with students. We recognise this service is new, and we're keen to work with SLC colleagues as well as to how we can improve communication to students.
And I mean, it strikes me the range of different conditions represented and the range of different organisations in this space. A 10-person advocacy group is a start, but it may not be as comprehensive as perhaps is needed. And again, I would encourage more communication on that front. But I think that's been a useful panel, and we will bring in the final panel. Thank you for your time today.
Thank you.
The proceeding is currently suspended. The proceeding is currently suspended. The proceeding is currently suspended.
Minister, and so on our final panel we have Baroness Barron, the Minister for the School System and Student Finance at the Department for Education, Anne Rimmer, Deputy Director of Student Funding Policy and Student Loans Company Sponsorship at the Department for Education, and Chris Lama, the Chief Executive of the Student Loans Company. Thank you very much for joining us. Nick, I'll hand over to you for the first question, and I'll pick up swiftly. Apologies that some members have had to leave because of other parliamentary commitments. Diana knows this is one of the perils of our existence, but I think we can remain quorate. Nick.
Good morning, and thank you for coming along to this session. I'll go straight into it, really. What is the department's rationale for changing the DSA system in this way? And what problems were you actually trying to fix? So I think that's a good question to get started with. I'll start with you, Minister, if I can.
Thanks so much, and thank you, committee, for inviting us today. So I think that the problems we're trying to fix, I think you heard pretty eloquently, particularly from the first panel. I think there was a very inconsistent student experience at best, and for many students quite a stressful experience where they felt they were having to drive the whole operation and link up with multiple sort of points of contact along the way with very little clarity about how to navigate that. So that was clearly very far from what any of us aspire to. So I think that was point number one. Secondly, there was, from a departmental point of view, and the SLC point of view, there was very, very little visibility. So each individual case was kind of taken separately, and there was no easy way to establish quality and then thirdly value for money. And I would stress that in the procurement for this, a very large weighting. I know there's been a discussion earlier about, are we trying to just push down price? We had no visibility on whether we were getting value for money, and we were buying, individual laptops for individual students or individual bits of software rather than using any of our purchasing power. So that, I think, we are responsible for trying to spend taxpayers' money well, but the emphasis in the contract itself was 60% on price. 60% on quality, 30% on price, 10% on social value. So I hope that gives a sense of where the focus was.
Thank you for that. Do you think they'll actually fix the problems then? I mean, obviously you wouldn't be doing it unless you did think you would, but I mean, what's your initial, obviously you've heard quite a lot this morning, what's your initial assessment of where we are?
Well, I suppose I would say that first of all, there's a big commitment to fix the problems. I know Chris will, I'm sure, talk more about this, and you've had snippets of it already, but I think there's a pretty robust system for tracking performance, both student experience, quality, and value for money, and there are very clear reporting lines set up, both the student loans company and then we meet monthly, so there's a clear line in at a ministerial level to the department. Obviously it is a major change, but I think a lot of the risk has been managed by appointing experienced organisations, by having very clear quality standards that were developed in discussion with experts in the sector, including, of course, third sector organisations, and having very good financial visibility. Any major programme change carries risk with it, but I think we can, I think we've got a good plan to address that, manage that, and for Chris and his team to execute that.
Chris, would you like to add anything to that?
Yeah, no, of course, Nick, and I'd echo what the Minister said. Previous to the current role, I led the operations team that looks after the disabled student allowance, so very close to the challenges that we're trying to resolve with this. My perspective, very similar to the Minister's. First and foremost, it's the customer journey, and Lesley, Sarah and Tara articulated that very well, that there is something to solve on the back of that. I think the big step change is taking the onus away from the customer, which it was on the previous model, back to where it should be, and that's with SLC through the suppliers. So they haven't got multiple handoffs, and they get the services that they need in a more timely way with less effort on their behalf. Early signs are good, but I won't echo what everyone said before. 57 days in, we've got a lot to prove.
Would you like to add anything at all?
I think what's already been covered sort of is where the department's perspective is. We worked jointly with the SLC on the procurement. We supported them, provided oversight, and they report, obviously, as the Minister mentioned, they report regularly into her, but then we also have quarterly reporting into our performance and risk process so that we're monitoring the performance of the KPIs.
No, thank you. Unfortunately, I have to leave, so I'm going to hand over to Robin now. But thank you anyway.
Thank you.
Thank you, Nick. And can I just ask, and I appreciate some things are commercially confidential, you can't go into all the detail about the procurement process, but in terms of just the structure of the way this was done, very interesting to hear about that focus on 60% on quality, 30% on price, that background you talked about, Minister. How, beyond the 23 KPIs we've heard a lot about already, how will you measure quality and outcomes from the process? Is there a role from the Office for Students in terms of looking at the persistence of the student cohort who are accessing DSA and how many of them actually complete their courses?
It's not something that I'm aware that we've considered, but I'm looking and see whether we have or haven't.
So I can come in and then, obviously the policy objective of the DSA is to bring disabled students at the level of their peers. Mm-hmm. So, and the OFS and the department look at the performance of institutions in terms of outcomes. The department obviously does look at the performance of how students perform against different courses, how those break down with different characteristics. We know from past evaluations of the disabled students allowance that students find this a critical support of their program, and also will continue to monitor their feedback into whether they're considering that the DSA supports their studies.
I think the figure in that research, which comes from 2019, but 68% of students reported that it allowed them to participate more fully, and 37% that they wouldn't have been able to participate at all had they not had it. So, those are quite significant numbers. I suppose my only slight concern listening to the earlier discussion about student outcomes is, which doesn't answer your question about the OFS, and I'm happy to take that away and look at it, is just there's so many variables in every student's life, and this is one element within it. I don't think we can I think we just need to get the right weight in terms of its contribution to final outcomes.
It would be interesting, obviously it's very early in the process, but it would be very interesting to have some kind of analysis of the completion rates for students who are accessing DSA before and after these changes, and hopefully if it's resulted in a better quality approach and better outcomes for those students, you should see those improving.
I think only if there's evidence that actually people were unable to take up their allowance previously, and I'm not sure we've got evidence for that. I think the evidence we've got is that it was complicated and potentially stressful for students, and I think particularly as we see a higher percentage of students claiming the allowance who experience mental health issues, autism spectrum disorder, ADHD, we can imagine that for many of those students, just the process of claiming it and the anxiety, I imagine that you might not get what you need, and all of those things could be substantial. I think the other element which you may or may not want to cover, Chair, today is obviously the non-medical help element, where we also, which is also part of the student experience, is outside DSA. Yeah. But as you know, we've got a call for evidence. We've got some concerns about that. I don't want to divert us.
But I appreciate the point we heard earlier from our first panel on that was that they're very keen to make sure that this process has been properly assessed and measured in a qualitative way, not just on the basis of KPIs for time, before any assumptions are made on read across from this process to that product. Can you give any assurance on that there will be a process of assessment before that call for evidence is responded to?
I mean, we're assessing this all of the time, and obviously, as you know, Chair, the wheels of government don't always turn as fast as one might expect. So a call for evidence doesn't mean an implemented policy in very short order. Can I just say one thing, if I may, slightly in defence of the KPIs? I think there was a sense given, and the committee may not have had a chance to look at them, but there was a sense given that they're all about process. And of course there is an element of process, but process is also part of the student experience. How quickly you get the call from, you've received your equipment, how quickly you get the call to book in your training to use the equipment actually is we don't want to leave students hanging around, but specifically there are student satisfaction metrics in those KPIs, and also complaints and other ones. So there's both explicit and implicit KPIs relating to student experience.
Were you involved as a minister in setting those KPIs, or was that a process which was run by a student-owned company?
Not. I'm looking left and right here.
I was very involved.
You were very involved. Well, that's the good news. That's the answer you wanted.
Thank you. And just in terms of the structure of the process, why were contracts offered on 4 regional lots? Obviously, the DFE in general uses interesting interpretations of regions, which is somewhat different to other government departments sometimes. And why were suppliers allowed to take on more than one of these contracts?
So I think the balance that, and obviously SLC led on the procurement, but as Anne said, our Investco looked at it. But I think the balance that SLC sought to strike was, one, to get the economies of scale in terms of purchasing power. Secondly, to spread risk, that we didn't have a single lot. There were multiple bidders. I think there were 15 initial bidders and 9 considered at the main awards. There was nothing predestined that 2 suppliers would get 2 lots. But Chris, this is really your patch rather than mine.
No, thank you, Minister. But totally agree with all that you've said. I think the first driver around the regional and the 4 regional was an enabler for us to get to this one-stop service model, which is so important to the customer, which we got from the research. The 4 slots felt through the research we did is the optimum amount for the economies of scale and the volume pricing. Those 4 slots were determined by the DSA applications received in previous trends, which felt right. The mix, from my perspective, between 2 and 4 was right. Anything less than 2, we lose that tension between suppliers and we lose that contingency, which we may come on to before. But I think 4 felt the maximum as well, to try and get this one-stop working as well as we possibly could.
And was there any element of kind of previous locations and expertise? Obviously, both Capita and StudyTech were operating in this market in its previous iteration. Did the determination around where they were placed relate to where they had existing expertise and connections with universities?
There was consideration to that, without going too much into the actual procurement specifics. But as an example, perhaps not so relevant for this committee, but Welsh language obviously was a key criteria for the Welsh Government for obvious reasons.
And obviously, when government departments work with private companies, there's always a concern around the risks of insolvency. We've seen some pretty big ones in the past, which have affected government. What account was taken over the risk in terms of just having 2 major primes, if you like, working on this, risks of insolvency and contingencies on that front?
From which bit? Sorry, Chair.
Just in terms of the process, how exposed is the department to the insolvency of one or other provider? We've seen very large companies get into difficulties previously, and we've seen small ones that scaled up get into difficulties previously in other areas of government. So what account was taken of that in the process?
I misheard. So followed the full government procurement process, so that part of it was taken into account. Then we get into the contingencies of why we've got a minimum of 2. So embedded within the contract, if either of the suppliers fails, then the other supplier steps up, at least for an interim perspective. If both fail, which is highly unlikely, bearing in mind one of the suppliers is a consortium of SMEs and the other one heavily subcontracts already in the market, but if both did fail, then the contingency thereafter is Student Loans Company take temporary ownership of the process.
And we've heard that during the process it changed from one which was about separate assessment and delivery to one in which they were combined. Firstly, is that correct? Yes. The process was initially underway on one basis and then it changed to another. What alternative delivery models did the department or the SLC consider?
There were a number of different models, but yes, do.
Yeah. So 5, if I may. So continue with the existing arrangement, which we deemed not appropriate, both from a customer perspective and a value for money perspective. Procure separately for needs assessment and assistive technology, which was considered on the first one. We believed getting further customer research that wouldn't have enabled the one-stop shop, which apologies for mentioning again, but that is so important from a customer perspective. Working with other government departments was considered, not deemed feasible in the time spell of doing it, and because of the differences between the two, several government departments that do similar activity. The fourth one I've mentioned, but would bring in-house. We did consider that. That's not the core role that student loans does, and by not progressing that option, it enabled us to have that as a contingency, which I think we all recognise is very, very important. And the fifth one was the competitive tender exercise for one-stop and a contractual model, which was the favoured by SLC, DFE and the Welsh Government.
And then in terms of, you heard some of the concerns of the first panel around communication in this process, and it's inevitable when something goes into a procurement process that there will be a period in which it is more difficult to communicate. I guess the question is, what was, from a department's perspective, the process of engaging with stakeholders, including students themselves, when designing and implementing these reforms, and now that commercial process is effectively over and you have providers in place, how can you improve the communication across the sector to ensure that the right people are getting the information they need?
So there was a lot of work with the sector in terms of consultation. So as you heard earlier, we did have substantial input from disability organisations. We worked with them to develop the quality standards before the ITT, and there is now a procurement subgroup, which I think I'm right in saying is working with us. And then we've got the DSA Quality Committee, which includes a number of organisations, to be a kind of independent validator of the quality standards. I think the department is absolutely committed to continuing to consult and work and listen to all those groups. I think we're just, as you rightly say, Chair, there's a moment during procurement when stuff goes quiet. And also, we really are in the early stages, as Chris said, we're day 57 or something. So it is very early stages, but we welcome, I'm sure I can speak for both our organisations, but Chris, please come in. We welcome feedback, quick and early feedback, but there are also mechanisms. So both the suppliers get student feedback from every individual student, and the student loan company takes a dip sample of student experience. So we're trying to track that quickly, respond quickly, but we also have regular systems to make sure that we have that input. But Chris, do you want to say from your perspective?
I think you've covered all. I would just add a thank you to Lesley, Sarah and Tara from the first session, but also for their support throughout and their organisation support throughout. And it's my accountability to make sure that we get the communication right for the sector and we leverage the expertise that's clearly in the sector. So that's my accountability. The likes of this forum and the other forums we've got in place helps us understand where we can do better. The first session clearly shows that I and the team can do better, and we absolutely will. I do believe, though, we've got the structure in place through either the disability student stakeholder group, the subgroup that's helped us design it, and the quality committee. I've gone to each of the two DSA quality committees that we've had so far. I'm going to the next one on the 10th of June. So again, this committee has helped with that. But we're committed to working with all parties moving forward.
Are you comfortable, just on the quality committee, are you comfortable that has sufficient access to the expertise that was previously distributed amongst a very wide range of assessment centres and in the quality group that held the ring for them, because of these concerns that were raised about, understandable concerns around commercial issues with competitors? Do you have access to the right people in order to assure that quality is of the highest standards.
My view is it's set up to do that, and the terms of reference is to do that. But the feedback from the first session means I will revisit that to make sure that we have got the right people on the DSA Quality Committee.
Thank you. Andrew.
Thank you. We've talked a little bit about metrics and measurements already, but just in terms of measuring not just how to set this up, but monitoring its success ongoing, I wondered what performance metrics are you using and what data are you collecting, and what's the baseline that you're measuring all of that against?
Would it make sense that we start with what SLC is doing, because that's then fed up into the department?
Yeah, can I just make a broader point on that, Andrew, if I may, just on how we view it. So, and I think we've heard it before. For me, from previous role in the operations side as well, the customer will ultimately decide whether this is a success or not. And from our perspective, that's twofold. There's one around what they say, and some of the qualitative KPIs we've got in place are around the survey. Did they get the choice for face-to-face and telephony? Were their needs understood by the needs assessor? Those sorts of qualitative feedback we'll get from the customers. But it's also about what they do. And I think, I don't want to quote, I think it was Tara on the first session, but DSA is so important, and it makes a difference between disabled students staying in education. So that, that's what they do. So this has got to make it as likely as possible through the processes that we put in place that they do stay within the education. But I can go through. I think the chair's already referenced. We've probably talked a lot about the KPIs. It's in 6 key areas as far as I'm concerned. That feeds into the the Disability Quality Committee, but it will also obviously feed into the supplier meetings that we have with both StudyTech and Capita, but it also feed into the benefit realisation infrastructure that goes into the department.
Baseline that you're measuring improvements from. Have you got a baseline?
Yeah. No, carry on.
Well, I was just going to say, I mean, no. This honestly, this is your bit. You answer.
So if we took, for instance, on the qualitative bit around from the surveys, we've been doing surveys previously, so that's the baseline that we would look to improve on. For instance, the service metrics. We've also got data around how long it takes. We've also got data around the multiple handoffs. So those are the types of examples that we'd baseline against that, and then we can demonstrate the improvement. On the broader, I'm not sure we're getting to the strategic business case part, but there's bits around the cost of serve and all of those things that we can feed into the department's tracking.
And how does the department track, but make sure that you're not just doing a huge amount of process that SLC is already doing, because all that takes up time, effort and money that then doesn't get, isn't then available for equipment for disabled people to actually use, because you're spending it on assessing assessments instead.
What we do is we work with the SLC to sort of work off of their KPIs, so that we use that as the we understood this from the procurement, we expect regular reporting on them, and then in terms of the DSA as a priority for the department, it features in our oversight governance of the SLC. So for instance, in our annual letter of priorities that the shareholders send to the SLC, the DSA features. It features in the regular conversations that we have, with Chris, with the ELT. But in terms of, we work off of those sort of shared set of metrics, so that, as you said, we're not duplicating or replicating needlessly.
Good, because I just want to make this broader point that process isn't free. The amount of process, everyone in these committees, I did it in housing yesterday, are we checking this, are we making sure that goes wrong, have we got an extra process to fit in with this? It all costs money that you then don't have to provide the service that is the whole point of the exercise. So just in terms of reliability then, you already covered that student experience is part of the data set, so I think I've had an answer to that. How do you ensure that the data that suppliers gives you is reliable, given their incentive to say all is well, which is understandable incentive? And how do you guard against the risks that the processes of assessment and provision are going to be controlled by one company, that they're doing the assessment and providing the equipment, and how's that mitigated against.
Chris, do you want to, because I feel like those are operational questions, I can add on at the end from the department's perspective.
It's not sort of trying to catch people out grilling, it's just trying to get the information.
Yeah, so best. And I'll give my view. I think and correct me if I'm wrong, Andrew, that's broadly around conflict of interest. Yeah. So I think the first bit of the introduction of the contracts enables us to manage that better than we could, for obvious reasons, previously. As you'd expect, SLC adheres to the government standards around conflicts of interest. Through this contract, we expect StudyTech and Capita to do that with enduring adherence. I would describe as 3 lines of defence from a risk management perspective. The first one, my team still own the overall disability student allowance product and offering. So our highly trained colleagues do have that quality check against the needs assessment reports that we've had coming in. So that's first line of defence. Second line is, because we've moved to this model, I've got a supplier management team that work with but support and challenge Capita and StudyTech. Data, as you'd expect, Andrew, is key to that. So they would be analysing the data once we get some further trends on that part. And then the third line of defence is GIAA. So they're due to audit me and the process in October.
Thank you. Is it worth just adding, Chris, there's just, in terms of actual controls, I know you made quite rightly the point about process costs, but the 2 prime contractors have a duty to inform SLC of any conflicts of interest with very severe consequences if they don't. It's agreed up front how they're dealt with, and then there's also a kind of open book accounting agreement, so SLC can look at, on an open book basis, the accounts of the contractors to make sure that there's absolute transparency, which we definitely did not have previously.
Yeah, thank you, it's very helpful.
Right. Just more broadly, we heard clearly from the first panel, big focus on measuring quality, reporting back on quality, ensuring that students recognise the quality of what's being done. How is the department going to ensure quality for students by holding suppliers to account for the outcomes and the quality of their performance?
Well, obviously, our direct relationship is with SLC, who, as Chris said, is ultimately accountable for the quality of this. We don't have additional metrics beyond the 20 much discussed KPIs, but as you rightly kind of probed earlier, we also have direct. So we have there are the 23 KPIs, and then there's the additional customer research, both that the prime providers do and the SLC does, and then we have our stakeholder groups and support, so to make sure that we're getting an independent voice from the sector. And obviously, you will very well know also if problems start to pop up that you as MPs get to hear about it, it comes through. So we try and triangulate the information that we get. But I think there's also something very important about these early stages to build confidence so that the narrative becomes among disabled students that this is actually a service you can trust, you get what you need, it's not stressful. So these early days are very important.
And Chris, can I ask, what alternative options exist if a student feels that they've been failed by their supplier? If at the end of the day, we've heard cases under the previous system where people might have been given the wrong assistive technology. If they come and they go through the complaints process and they come to the SLC saying, I've got the wrong outcome here, I don't have the support I need, what can you then do about it?
So I think the key stages is the first one is that they would contact their supplier, who I would expect, and as part of the contract and agreement would be to resolve that. If that's unsuccessful, they would come to my team. Again, we've got 200 DSA highly trained colleagues who with tenure of decades in some cases, so they would be able to support with that. And the supplier management team who would liaise directly with the supplier. So in those sort of cases, we'd work with both Capita's team and Study Tech, and often directly with Glenn and co. To resolve that, whether that's a different needs assessment, we would take that forward as appropriate.
Mm-hmm. And do the contracts contain any definition of performance failure, and what are the department's contractual rights in the event of consistently poor performance?
Yeah, no. So again, you don't want me to mention KPIs again, Chair, but the KPIs are a critical part to those contracts. Then there's relatively standard terms attached to the contract. In this case, because we have the two suppliers, if the normal performance management hasn't got to the recovery of the service that we want, which I'd expect it to, although it's early days, but I would fully expect that to happen, we have an option which is built into both contracts that the other supplier would take on a part of the other supplier that hasn't delivered lot. And then ultimately we do have clauses around termination if needed, and similarly to my contingency model I talked about earlier, then it would all go on a temporary basis to the other supplier.
And are there, has the SLC intervened on any performance issues to date, or is that just an ongoing low-level conversation, if you like?
Yes, it has.
Right.
And that was not for the performance today on the 57 days. That was in the quite rigorous process of making sure that the readiness checks were in place, so that when we went live February the 26th of this year, we did so as successfully as possible. So that would be me with the supplier team that we've spoken to earlier. I also have had calls and will continue to with my Oppo in both areas, so Glenn or Richard from a Capita perspective.
And just on the issue of face-to-face assessments, we heard earlier quite different approaches across the two contractors. I think it was 94% for Capita were remote, and around 80% for Study Tech. A view that the face-to-face assessments are likely to increase, but still, from what we heard from the first panel, be substantially fewer than were under the previous operating system. Is that something you're comfortable with, or is that something you expect them over time to go back to where they were before the pandemic?
So ultimately, it's the customer choice, but no, I don't agree with the first part of it. So from the data that we've had from the suppliers for the first 57 days. Previously, from our data, it looked like around about 10% were done face-to-face. It's nearer 20% now, which feels right. On the qualitative feedback that we got from customers on the old model, around about 40% of customers felt that the old model wasn't giving them the choice of face-to-face and virtual. And that's obviously not where we want to be. We need to make sure that the choice is there for the customers to make, and then if they do make that choice, then the service is there for them. But I do expect more face-to-face moving forward, but ultimately that's if that's right for the customer, because sometimes face-to-face isn't right for the customer.
In order for every customer to have that choice, it requires the providers to have that footprint, them or their subcontractors presumably, in every HEI or FE organisation, which is quite a large footprint we're talking about compared to what they have today. Is that a process you're monitoring in terms of how that will change over time?
Absolutely, monitoring the customer demand, which is the key part to it, and the expectation with the suppliers that they react to that demand within reasonable. Sorry, I interrupted.
No, go on.
No, I've finished that part.
So I think this is an area where more 2 points. One on the first one about face-to-face. It is an area where I think more work is needed to really understand what students want. In preparation, I went on, I'd like to say I'd done it earlier, but that wouldn't be true. I went on and looked at the information for students on both the Capita and Study Tech websites, and it is extremely clear that it's your choice. It also sets out 2 or 3 reasons why you might want face-to-face, 2 or 3 reasons why it might be preferable for you, and it's also very clear that the expectation is around 2 hours for the assessment. So obviously, you know, the proof of the pudding will be in the eating, but I think it might be interesting for the committee to be aware that there are also suggestions from some students that actually, if they're really clear on their needs, they feel the needs assessment part is actually superfluous and they would rather go straight to the purchasing of the equipment. So that's something that we're going to look at, and I would really underline that is not from a kind of cost point of view, that is from an exploratory bit of work in response to student feedback. So the point is, for some people face-to-face is right, for some people online video call or telephone call is right, and for some potentially we need to be confident whether actually for some it would be appropriate not to.
And you're comfortable from what you've seen in terms of the information that is there for those students in the cohort currently, that they are being given a genuine choice with pros and cons on both sides, not guided in a particular direction.
Well, maybe after this session I can do a mystery shopper. I'm not sure if that's ethical. I didn't do it beforehand, but you know, as I say, I felt it was very clear and transparent and balanced.
And I have to say, from my experience in the department, I'm not surprised to hear that Minister Barron does her homework before coming to a session of a committee. But I just wanted to ask, there have been some concerns raised, and concerns raised by some of the providers who perhaps didn't win this process around the suggestion that by focusing on the cost of assessment, there could be an incentive for the cost of assessment to be brought down and the cost of equipment to be used to compensate for that. And it was very interesting to hear, and I think very open of Glenn to talk about the balance of revenue in the different parts of the business there. Are you comfortable that there's sufficient breadth in the supply chain when it comes to assistive technology that is there, and that the margins are being managed in a way that doesn't allow for anti-competitive behaviour when it comes to the equipment and assistive technology market?
So, I mean, from our perspective in the department, there had already been, you know, there's been a longer trend in terms of, you know, what we might politely call consolidation in the market and a reduction in the number of suppliers. I think that's where the transparency of the contract and the open book accounting and so forth gives us visibility in a way that we simply didn't have before. I think the second point to make is we just need to get the mix right. This, you know, we previously had a cap in terms of needs assessment costs, and pretty much every needs assessment's price was right at the top of the cap. We have, through the procurement process, established, if you like, a kind of market price, and we just need to get the balance right between a high-quality needs assessment and then sufficient funding for you know, to meet students' needs in terms of technology and training. And as I think the committee is aware, there is a tiny, I think it's 0.1% of students who actually hit the cap. So it's very rare that students hit that 26,000 plus cap in terms of what's available.
Anything to add to that, Chris?
Yeah, so I would agree. I think the nature of the commercial process for the first time has allowed us to do a market-led around the prices. So effectively going through that process has enabled us to set or reset the prices. But I do think your point is an important one. So as well as that, in the contract, there's an annual review of those prices linked to CPI, but more important to me, that's looking at it of whether they're too high or too low, because I think that's part of your questioning, that obviously the high bits around value for money and making sure that the customers get as much of the allowance as they possibly can, but if it's too low, it will drive the wrong behaviours that none of us want. So that important checkpoint is there as well.
I'll bring in Mohammed.
Thank you so much.
Waiting patiently.
Yeah, thanks. The FE's recently called for evidence regarding the non-medical help system. What's the rationale behind this?
So I think some of the patterns are a little bit similar to what we saw previously in the other areas of DSA that we've talked about. So it's a very, very fragmented market. We think there are around 500 suppliers. Again, each package of support is chosen individually and purchased individually, so there are no economies of scale in purchasing. Students have told us that there's a kind of lack of integration between the DSA end and the higher education providers' support. Same message from students about complex for them to navigate administratively, and we've also heard specifically about shortages of particular elements in the workforce, for example, those with British Sign Language skills.
Are you proposing any further reforms to the DSA application process?
So this is much too early to say. What we've announced is a call for evidence, which is to find out in much more detail about those concerns, but also others that students and other stakeholders would want to raise with us. Is there anything, Anne, you wanted to add about?
No, I'd just say that we know how important it is to understand the student's voice, the HEP's voice in particular, and the way non-medical help is sort of aligned with the broader teaching, the experience of the sector, which is, we've covered today, is incredibly knowledgeable. So before sort of we form any views, we want to really benefit from that expertise and understand, what element, because this non-medical help was not covered by this reform. Are there any things that we should consider? Recognizing that this policy has been in place for a long time, and it's worthwhile just consider, is this working as well for students as it needs to?
If you go back in 2015, when a large proportion of what used to be funded via the DSA was shifted into institutional budget, both core and disabled students related funding was slashed per student. So the concerns are that the latest plans result in overall cuts to disabled students' sport funding. Are you agree with these concerns?
I'm not sure that we do agree, but could you just say again the dates that you were talking about in terms of slashing of support?
2015.
Are you talking about the contribution towards a personal computer, the £200?
In 2015, large proportion of what used to be, funded through DSA was shifted to institutional budgets, and as a result, the funding was cut for both core and disabled students. But the concerns now are that it's maybe the same exercise happening again, and it would result in cutting students, both disabled and others funding per student. How concerned you are, and
so I'm just looking at.
Give us a clear answer that it's not happening this time.
So I'm just looking at the data. So including non-medical help, I think I'm right in saying that this is my maths, not the department's, which is always risky. But that over the last 5 years, so if we take 2017-18, the per student amount was 1,843 average, and we know that average is only so helpful in this area, but it gives us a sense. 21-2, which is the latest data that we have, was £1,940. So I haven't gone back to 2015-16 because I thought it was worth looking at the last 5 years, and I apologise, I don't have that institutional memory. That's before my time in Parliament or in the department, but Anne may have a better institutional memory. But I think the point I'm making is we want as much money to go to the student for the stuff that's helpful to them as is reasonable, as I said earlier, getting that balance right. And I just felt it was worth raising those two figures because that doesn't look like a slashing of funding per student, and that's obviously over a time when the number of students in receipt of DSA has gone up by 19,000 from just over 68,000 to just over 87,000. But Anne, do you want to talk about the 2015?
What was introduced in 2015 was a requirement that students now need to make a £200 contribution to the cost of a computer. Right. And the rationale is that, as I said, the objective is the goal of DSA is to bring students up to their peers. A basic computer is now a mainstream cost of study, and so it was considered fair that students would make a £200 contribution to the cost of the computer when recommended by their needs assessment. This is for hardware only, and students are not expected to fully fund recommended specialist software or the training of that software. So this was just a £200 contribution for laptops to reflect that a laptop is now part of a basic cost of
basic human right.
Pardon, mainstream cost of study.
Perhaps to clarify this issue, what would be helpful as well if you could provide us with a time series going back a bit further.
Of course,
absolutely. If you can give us some data.
Yeah, no, gladly. We've got it all here. I just did 5 years rather than 9 years.
So some disability rights organisers are really concerned that removing further individual payments and transferring them to universities will confuse and dilute students even more. What safeguards are there in place to avoid this and to ensure the universities who are struggling financially already will get proper support to make sure that to deliver an equal disabled student sport experience?
You want to take that, Anne?
So I think higher education institutions have obligations under the Equalities Act to provide support and accessibility to students. But the DSA recognises that there are specific costs that students may face as a result of their disability, and so that's sort of the underlying rationale for the DSA is to mitigate that risk. The call for evidence, and I don't want to risk repeating myself, is about understanding what this means for students on university campuses who are learning today, and that we can be at risk of being quite far away sometimes from what that student experience is, and making sure that we know, in 2024, what does that experience look like, and how can we make sure the policy is supporting it. So I think that the DSA, as an entitlement, sort of protects that the students get that additional funding where they need, recognizing that HEPs have a legal obligation, and the call for evidence is sort of separate from that.
Yeah.
So are you taking the concerns from some disability support organisations on board, because they are really concerned that the disabled students be confused with this change, and the university won't be able to look after them because they're financially struggling already?
I don't think there's any change proposed, and I think that's really clear. Is that we're not consulting; it's really let us understand what's going on, and we ask questions to sort of help prompt once the people aren't faced with a blank sheet of paper. But there is no change that students need to be concerned about being proposed at this time. We're gathering evidence to understand what would be, if anything, would be appropriate.
Okay, that's helpful.
Can I just pick up on something that was mentioned earlier, which felt like it might have been a misunderstanding about universities opting out of DSA. I mean, DSA is a student right. The university can't opt out. They can do more.
Provide
they can
do
as much
mechanism.
As they can afford to do, but just
yes. No, I mean, I think that's fair, and I think it is certainly the case that some universities are doing more off their own bat than others. And there's a question around how they can afford to do that. I know, my own university and University of Worcester prides itself on being very inclusive and doing a lot on that front. But I think the concern would be with the state of student finance in general, that there will be a lot more pressure on the pot that is available for DSA if it's to achieve its aims. And obviously with the government's aspirations to halve the disability employment gap, ensuring that people have the opportunity to pursue studies successfully is a very important part of that. So I think this is an area the committee will continue to take an interest in. I'm grateful you've been generous with your time today, and we will write to you, I think, off the back of this. And if you could write just with a little bit more data in terms of the overall DSA funding over the years, that would be helpful, I think, for the committee. But I'm grateful for Minister and Chris and Anne for your evidence today. I will call the session to a halt. Order. Thank you.
The proceeding has ended. 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 The proceeding has ended.